Mrs. Savita had severe pain in both knees since many years, which was severely affecting her ability to walk. She had tried all types of medicines, physiotherapy, braces, lifestyle changes, and even knee injections, but was not getting better. On our advice and guidance, she opted for both knee fast-track replacement surgery using muscle-sparing subvastus technique. Getting better. Walking few hours post-surgery. Standing with support few hours post-surgery. Let us be inspired by her recovery journey post-surgery. Standing and walking one day after surgery. Walking in hospital corridor one day after surgery. Stair descending 48 hours post-surgery. Stair climbing second day post-surgery. Stair climbing at home. Walking at home with walker. Walking with stick. Cross-leg sitting post-surgery. Dancing without support 1 month after surgery. Patient feedback. 3 months follow-up. Jogging after surgery. 6 months post-surgery. Pain-free sitting and standing. Straight leg alignment after surgery. 1 year follow-up. Google review. Dr. Kunal is soft-spoken, young, energetic, competitive orthopedic surgeon. Before my knee transplant, I was scared, as my relatives and friends have told me that after surgery pain is unbearable. But in my case, Dr. Kunal has performed both knee transplants very well, and his pain management was excellent, as after surgery I had no pain during first 3 days. Secondly, Dr. Kunal is very polite and responds to your query immediately on phone or WhatsApp, even in odd hours. People say there is God on earth and nobody has seen God, but I have seen God on earth in the form of Dr. Kunal Aneja. I am very satisfied after knees transplant and recommends Dr. Kunal Aneja.